A lady lost her pregnancy and nearly lost her life to septic shock, and this was her story. Immediately she found out that she was pregnant, she started her hospital visits. On one of her hospital visits, she was told she has a short cervix. Short cervix is one of those things that can lead to second trimester loss. Cervical incompetence is when the person's cervix is not able to hold the pregnancy, and then the person's cervix starts opening earlier before the time the person should give birth. When she was given this diagnosis, she went ahead to read about it, and she found out that she should get a cerclage because of this. She went ahead to speak to her doctor, who told her not to worry about it and carry on her normal life, and that this will not affect her pregnancy in any way. At this point, I think it is where she would have changed the doctor, because she has read about short cervix and knows the potential risks that comes with it. If I were in her shoes, I would have looked for a second opinion, but I am not going to blame the patient here. Possibly she didn't know to what extent a short cervix can get to. She continued to live her life normally and traveled to different places, and then at 23 weeks of pregnancy, she started to notice blood. Immediately she saw it, she went to the hospital. Getting to the hospital, she was told she would be needing a cerclage. The same cerclage she requested from her doctor, and they refused. So she agreed for the cerclage to be done, and she signed a lot of documents, and at the point when they wanted to do the cerclage, that was when they found out that the leg of the baby was already coming out from the... At this point, there is nothing again they can do about it. She had to deliver the baby immediately. According to her, she was confused at this point. How did I move from being pregnant and now I have to give birth to my baby at 23 weeks? They took her to where she would deliver the baby, but at the point, they noticed that her blood pressure was dropping so low while her temperature was increasing. They checked her infection markers and they were skyrocketing. That was when it was done on the doctors that this lady was entering into septic shock. For some of you who don't know what septic shock is, it means that the person's body is fighting infection and at the same time fighting her organs. Septic shock can lead to organ damage. It can destroy some of the organs of the body, and it is one of those things that can die somebody very quickly. They decided to do an emergency surgical procedure to bring out the baby. Before the surgery, they had to give her a general anesthesia. After a procedure, they would usually bring you back, that is, make you to come awake again. But in her own case, she was awake, hearing everybody, but her eye couldn't open. That was when it was done on her that she was in coma. This lady was in coma for 4 whole days, and at the time she woke up, she lost her ability to do certain things. She had to relearn how to talk, how to walk, and how to do things by herself. I am happy that this woman survived this septic shock, because sepsis is not one thing that will keep you alive. For a pregnant woman out there, please learn to advocate for yourself and seek for second opinion. If you are not happy with what a doctor has told you, you can ask for a different doctor to recheck you. I hope this video helps all of you. I am still your Bongo Nation President, and I will see you all in my next video.